Dr. Kevin Ende again discussing hairline lowering surgery in the older age group. Now, when we do a hairline lowering surgery on a patient like this in the older age group, the procedure really doesn't change at all. It's the same procedure that I would have performed for a patient in the younger age group. We can see that the scalp and the forehead are at a very steep angle to each other here. We basically have, the brows are right in this area, and as we travel up here, we can see that it's a pretty normal vertical forehead. And then as we are going to be going back like this, we can see there's a pretty sharp angle right in here. I also want to point out this area, which is a sort of a crease in the scalp, and believe it or not, that is an area that's almost a permanent indentation in this patient's head from wearing wigs, which have compressed this area. Wigs, hats, whatever thing compresses that area, but this patient has used different devices to cover that up. And this is the position that she desired her hairline to move forward to. And as we can see, that is a pretty far distance to come forward, but that distance basically is achievable in a one-stage hairline lowering procedure that takes approximately 1 hour to perform. And that brings her to a point that is just behind where the scalp starts to slope up. Again, we have the vertical dimension or vertical direction of the forehead, which right at this point starts to slope back. So achieving a hairline right about there, which is right after the hairline or the scalp starts to slope back, is a very desirable location for the hairline.